Having a joint replacement is a really big decision to make, and a lot of people are nervous in the beginning because there's a lot of what ifs and what's going to happen after the surgery. So the goal of the pre-op joint replacement program is to get to know your rehab specialist, be out of the hospital faster and hopefully straight to home. You're going to be getting stronger and more mobile prior to the surgery. The stronger and more mobile you are going into the surgery, that's what you're going to wake up with after surgery. You're going to have stronger muscles and a more flexible joint. So basically, overall, your pain's going to be less, your range of motion will be better, and basically the whole return to your normal lifestyle will be faster. I've seen a lot of people really benefit from doing the pre-op therapy ahead of time. I recently have just treated a patient for 4 weeks of pre-op therapy going into a hip replacement. She came home from the hospital, didn't need to use a cane, and went back to work as a real estate agent at 2 weeks post-op. Everybody in the community is saying, you're faking it, you didn't really have a joint replacement. And really, it's because her muscles were so strong going into the surgery that there was minimal trauma to the muscles afterwards. So she didn't have the gait imbalance deficits that a lot of people have after a joint replacement surgery. Let me show you some exercises that you can do both preoperatively and postoperatively for a total knee replacement or a total hip replacement. Before we start, let me remind you at Ivy Rehab, we don't believe in the no pain, no gain mentality. If you are having pain with these exercises, we encourage you to go into a Ivy Rehab location, meet with one of the physical therapists, review the exercise with them, because we may have to tailor a treatment plan specifically for you. Remember, all these exercises can be done in your bed at home. You do not need to be on the floor for them. The first exercise is called straight leg raises. What I want you to do is bend your opposite leg, straighten out the knee or hip that's going to go into surgery, pull the toes back towards you, tighten up the quadricep muscle, lift the leg up to the height of the other knee, hold it for 1 second, and then relax it back down. You're going to repeat this move 10 times and do 2 sets of it. The next exercise is called quad sets. What you're going to do is you're going to bend the opposite knee and put 2 hand towels rolled up right underneath the knee. You're going to gently press down with your muscles, trying to squash the towel. Hold that 10 seconds and repeat it 10 times. The next is called heel slides. What you're going to do is you're going to bend the opposite leg, place a towel underneath your heel. You're going to slide your heel as far as you can up to the height of the other knee. Hold it 1 second and then relax it back down. We're going to repeat this 10 times and do 2 sets of it. The next exercise is called hip adductor squeezes. What you're going to do is with a soft ball, place it between your knees with your knees in the bent position. Gently squeeze the ball, hold it 10 seconds, and repeat that move 10 times. If you don't have a ball, it's okay. You can use a folded pillow at home. The next exercise is called terminal knee extension. Using 1 bath towel, roll it up, place it underneath your heel. You want there to be space between your leg and the floor to let your leg stretch out. You're going to hold that for 5 minutes and just let your leg relax. That's called the no exercise exercise. The last exercise is called ankle pumps. Scooch down to the end of your bed. All you're going to do is pull your toes towards you, pumping your ankle up, and then relax it back down. Do this 10 times and do 2 sets of it. So there you go. Those are the exercises that you can do before you have a total joint replacement. But remember, come into one of the Ivy Rehab locations, check out our facilities, meet your rehab team, learn the exercises that you need to do to get your joints more mobile and your muscles stronger so you'll recover even faster.